Hey guys, what's up? It's me, the-kyle-chronicles, and I am back again with a new episode of Smarter Sex Stuff. In case you're new to this, it's my sexual education series I'm doing to teach you guys stuff and to be more inclusive because I know sex ed kind of sucks in most high schools. So this week we're going over all the different types of STIs, which, in case you don't know, stand for sexually transmitted infections. There used to be two categories. There were STIs and STDs, which stood for sexually transmitted diseases, but they just kind of grouped them all together and went with just STIs. So we're going to be going over all the different kinds there are, the symptoms they'll show, and treatment options. And like all other videos, there will be a lot more information in links down in the description for you guys to check out. So might as well begin. So first one is cervicitis, and that is caused by other STIs, and it is the inflammation of the cervix. So if you don't have a vagina, you won't get this one. Some of the symptoms are pain during sex, spotting and bleeding when you're already off your period, and increase in vaginal fluid. Treatment option is antibiotics. Next one is chlamydia, which it can be passed through anal, vaginal, and oral sex. Some symptoms for those with a vagina include pain during sex, pain in lower stomach, burning, and pain when peeing. And there's different symptoms for if you have a penis, which includes itchy feeling inside your penis, pain and swelling testicles, and rectal bleeding or pus. Treatment are also antibiotics, and for most of these you should also tell your partners that you've had for the past 2 months because they should go through the treatment whether or not they are showing symptoms. Next one is gonorrhea, which can be found in the urethra, vagina, rectum, and throat, although throat is less common. This one you can have it without having symptoms or very, very mild form of symptoms. So that's kind of why it's really important to get regularly tested. So now, if you have a vagina, some symptoms include pain in lower stomach, bleeding after sex, more painful periods. And for those with a penis, need to pee more often, unusual fluid from penis, and pain/swelling in testicles. Treatment again is antibiotics. Now we're moving on to the hepatitises. There are 3 types, A, B, and C, so I'll be going over all of them separately. So hepatitis A is the inflammation of the liver, and it is passed through oral to fecal transmission. So that means, like, if you're giving somebody a rim job, if you go to the bathroom, don't wash your hands and prepare food, contaminated water, etc., etc. This is the one that you're usually warned about when going on vacation places. So symptoms for this include feeling very tired, becoming jaundice, which is the yellow of, like, your skin kind of gets a yellow tint and your eyes do, pain where your liver is, rashes, and pain in joints. Treatment for this, there is none. It will go away on its own. It's just typically suggested for you to rest up, drink lots of fluids, you know, how you treat a cold or a flu. Hep B is also inflammation of the liver. This one is spread through contact with blood and other bodily fluids. Symptoms, it can feel exactly like a flu, skin rash, diarrhea, or constipation, you know, 2 opposite ends of the spectrum. Mild fever or loss of appetite. Once again, there is no treatment for this one. You treat it like you would a flu. Hepatitis C, this one is what I consider the more serious of the 3. It is, again, inflammation of the liver. It is passed through blood-to-blood contact and sex. So blood-to-blood means, like, if somebody used a razor and cut themselves, got blood on it, and then you use the same razor and you have a cut, it can transmit through that way. Or if you're using a needle and sharing it with somebody, stuff like that. So symptoms again include jaundice, dark urine, muscle pain, and anxiety or depression, or both. Treatment, it is IFN. I have a lot more information on this treatment in the description, so I highly suggest you look at that. But for this, if you have Hep C, you should see your doctor every 6 to 12 months. And the cure works for about 70% of people. For more extreme cases, you may need a liver transplant, but I'm not a doctor, so those are all the hepatitis though. So now we move on to herpes. There are two types, HSV-1, which most people know as cold sores, and then HSV-2. They can both be found on both your mouth and genitals, and they are spread from skin to skin contact. Symptoms include itching, burning, sores, swollen glands, so like the things in your neck, and fever. Treatments for those are antiviral medication, and once you have it, you most likely will have it for life. Next one is HIV/AIDS. Mostly it is HIV, but left untreated it becomes AIDS. So it is a virus that attacks your immune system, and it can be passed through semen, blood, breast milk, vaginal, and anal fluids. Symptoms include fever, sore throat, and swollen glands. They do have a treatment for it. It is a combination of medicines referred to as highly active antiretroviral therapy, or HAART. If it's not treated though, so if you don't go get that treatment, it will develop into AIDS, and there is no cure for that. Please get tested and get treated. Next one is HPV/genital warts. HPV includes a group of over 100 types of viruses and more than 40 just for the genitals, and it is spread through skin-to-skin contact. Symptoms include bumps on genitals or the butt. HPV can turn into cervical cancer for people with a vagina, obviously, and another symptom for that is unusual/heavy bleeding when you're already off your period. Treatment, liquid medication and freezing them for the warts. For cervical cancer, obviously there's a much different treatment, and I will link that in the description. Next one, the acronym is LGV. It involves the lymph glands in the genital area, and it is caused by a strain of chlamydia and is passed through oral, anal, and vaginal sex, obviously. Symptoms are open sores in genital area, fatigue, swelling of pelvic lymph nodes, and discharge/bleeding from rectum. Treatment is, this one got really specific compared to the other ones that just say antibiotics. So the treatment for this is doxycycline 100 milligrams orally twice a day for 21 days. There are other forms of treatment, but this is the most commonly used one. PID, another one, that is the acronym, but it's going to be on the screen what the full word is. It is an infection of the uterus, fallopian tubes, and ovaries. So obviously if you are a penis person, you're safe. It happens when bacteria travels up from the vagina into the reproductive system, and it is commonly caused by chlamydia or gonorrhea. Symptoms include pain in lower abdomen, fever or chills, lower back pain, and need to pee more often. And the treatment is antibiotics, although if you have a more severe case, you will most likely be admitted to hospital for them to administer the antibiotics through an IV. So the next one is pubic lice, or as you guys probably know it, crabs. So they are tiny insects that live on body hair, and they are spread by close person-to-person contact. What this means is you don't necessarily have to be having sex with somebody. If you use a towel and you already have this, then someone else uses that towel without washing it first, they can contract the crabs. So yeah. Symptoms include itchiness and small rash, tiny tan-colored specks. Those specks are the eggs. And a treatment, there's a special shampoo that you can get. It's not like you don't need a prescription for it. It has directions, and in case they aren't clear, you can ask a pharmacist for them. And for the rest of your house, you should wash everything at least, I think it was 50 degrees Fahrenheit. And for anything that cannot be washed, you should put in a plastic bag or garbage bag for a week. That way it kills everything off. Second last one is syphilis. It has 3 stages, each which have their own kind of symptoms, and is passed through skin-to-skin contact. So symptoms for stage 1, there's a painless sore, but besides that, it's kind of symptomless. Stage 2 includes a non-itchy rash, hair loss, and swollen lymph nodes. And for stage 3, you most likely will not have any symptoms shown. The treatment for this is penicillin, but if you are allergic to penicillin, don't worry, because there's a different antibiotic treatment available. And the last one is TRIC, that is the shortened version of the name, and this is passed through vaginal sexual contact. Symptoms include itchiness and redness, discomfort when peeing. There might have been one more that I forgot to write down, but again, in the links in the description. And the treatment for this is a single dose of antibiotics. So those are all the different type of STIs you can get. There are a few infections you can get that are caused by STIs that I did not mention, but they will be also in a separate link in the description. Sorry for all the reading you're gonna have to do in the description, but I will do my best to make it as organized as possible for you guys. And yeah, I hope you guys enjoyed this video, even if it's not the usual kind of video you would watch on YouTube. And I will see you guys next week. Bye.